And today, this is perhaps the most critical question we have to handle. This is one of those questions that could, in fact, save someone's life. Pancreatic cancer. It's a silent killer with quite late detection, so the symptoms are everything. The pancreas is an organ in the abdomen, lying behind the lower part of the stomach. Pancreatic cancer is cancer that starts in the tissues of the pancreas. This kind of cancer is really serious because it's hard to find early on, which makes treating it harder. This is because the symptoms may not be immediate or may even be confused with everyday common issues from the host of other reasons one might be experiencing them, not necessarily cancer-related. That's why knowing what signs to look out for is super important. In our video today, we're going to talk about the 10 warning signs of pancreatic cancer that you shouldn't ignore. These are like clues to you that something might not be quite right. Your body can let you know with these warning signs. What a difference it may make if people come in to see us earlier. What a difference getting the right treatment earlier may mean in terms of feeling not so great to feeling better, or even living longer. Some of these may surprise you, and others might be some things you have heard of, but did not know they could be associated with pancreatic cancer. The pancreas, an organ about the size of your hand lying behind the lower part of your stomach. Pancreatic cancer begins when abnormal cells in the pancreas grow out of control and form a tumor. Making hormones to control blood sugar and enzymes to help us digest food is the role of this really important organ. The pancreas is, therefore, treacherous in the sense that pancreatic cancer does not show very clear signs that something is wrong until the tumor has grown to a fair size or has spread to other places in the body. This is a big reason it is often found in later stages rather than earlier. The most salient drawback of pancreatic cancer would be the relatively nonspecific nature of the early symptoms of the disease. Sometimes, early warning signs may be as easy and interpreted completely differently, like stomach pain, weight loss without trying, or feeling very tired all the whole time. Such symptoms can easily be confused with trivial health problems, whereby people wouldn't rush for a doctor's consultation at once. Such procrastination gives time to the silent growth of the cancer. Being informed helps us make better decisions for our health and encourages us to seek help when something feels off. Let's get started. 1. Jaundice. Jaundice is a state of health in which the skin and the whites of the eyes become yellow due to increased bilirubin in the blood. Bilirubin is a yellow pigment that the body produces when it breaks down old red blood cells. Normally, the liver processes bilirubin, mixing it with bile, and then getting rid of it through your digestive system. However, under normal circumstances, the liver may be incapable of releasing bilirubin, or there may be a problem at any place that removes bilirubin. When a high amount of bilirubin gets into your body and accumulates, you may become jaundiced. This isn't a disease on its own, but rather a sign of an underlying health issue. There are several reasons why someone might get jaundice. This may be due to liver sicknesses such as hepatitis or cirrhosis, in which the effective breakdown or processing of the bilirubin in the liver may not be properly realized. It may also occur when there is an obstruction of the bile ducts, i.e., the passages of the bile from the liver to the intestine. This could be from gallstones or, in very severe cases, from cancers pressing upon or blocking these ducts, such as pancreatic cancer. Jaundice in adults often indicates a significant health issue that needs medical evaluation. In addition to yellowing the skin and eyes, it can be associated with other signs such as dark urine, pale-colored stools, and itching. These indicate to the doctor what is causing jaundice, for it is impossible to treat it without treating the problem that caused it. The awareness of jaundice and its meaning should hence be very key. This then would be the clear indication from the body of something that would have definitely gone wrong, more so with the liver or bile system.
2.
Unexplained weight loss. Unexplained weight loss is a condition that occurs to a person without the intention in the cause of dieting or exercises. It's when you lose your weight without actually being aware or realize it yourself, be it that your clothes are fitting looser or dropping numbers on the weighing scale, when you have not changed your eating or exercise habits. While it might seem like a welcome surprise to some, it can actually be a sign of an underlying health issue. This weight loss could be of an all-of-a-sudden kind, not intending to, and whenever such is the case, then it might tell us a thing or two, that apparently your body isn't getting the required energy from your diet. There might as well be burning of more calories than usual due to disease processes, among many other possible reasons. This can be one of the symptoms indicating conditions of an overactive thyroid, hyperthyroidism, diabetes, depression, or digestive diseases. Most importantly, this is also one of the common symptoms occurring in many types of cancers, including pancreatic cancer. Unexplained loss of weight may happen in the course of pancreatic cancer because of several reasons. The pancreas may be involved in such a way that its exocrine function for the production of enzymes facilitating the digestion of food is compromised, leading to malabsorption and hence weight loss. Otherwise, a tumor pressing against the stomach can leave the person feeling full with only a small amount of intake of food. Any cancer, in general, increases the rate of metabolism, meaning quicker burn of calories than the body actually should. Unexplained loss of body weight is a warning sign that should always be taken with due seriousness. Symptoms should attract attention in case they are quite pronounced. For example, body weight loss of more than 5% in 6 to 12 months, accompanied by other signs of illness. 3. Abdominal pain. Abdominal pain is one of the common symptoms. It is pain affecting the area between the chest and the pelvis. The intensity of this pain may be from slight discomfort to severe distress. Causes of pain in the abdomen are varied, as this region of the body covers many important internal organs, such as the stomach, liver, pancreas, and intestines, and the origin of the pain can be hard to find at times. They may relate to the underlying pathology or be characterized by the location of pain: sharp, dull, intermittent, or constant. One significant concern with abdominal pain is its potential link to serious conditions, such as pancreatic cancer. In pancreatic cancer, pain progresses and is normally focal in the upper abdominal region, with referred pain going to the back from the side. This may be due to pressure from a tumor against organs or nerves around the pancreas. The discomfort can increase after eating or when lying down, and it will become more constant when the cancer spreads. Abdominal pain can also be symptomatic of less severe conditions, such as indigestion, gas, or a stomach virus. Don't ever ignore the pain in your belly, especially if it continues or if other accompanying symptoms occur. 4. Digestive issues. Usually, digestive troubles include the general kind of symptoms which affect the gastrointestinal tract from the mouth to the anus. They usually take the form of nausea, vomiting, diarrhea, or constipation. Changes in the consistency or color of the stool occur, mostly in a loose or liquid texture. Digestive problems can range from mild conditions, leaving one feeling slightly uncomfortable, to serious conditions that impede daily activities and even overall health. For instance, the cause may be a really common factor and result from dietary choices or stress, or possibly from infections to more serious ones, like the already mentioned chronic conditions or digestive organs diseases such as ulcers, gastroesophageal reflux disease, or another essential on the pancreas and pancreatic cancer involves digestion. The body's enzymes, which are secreted, help in the digestion process of fats, proteins, and carbohydrates for use in preparing the body for nutrient absorption. So, where cancer upsets this function, the absorption of nutrients is impaired and hence digestive symptoms. For example, in pancreatic cancer, nausea and vomiting are experienced because a tumor blocks the stomach and, therefore, food does not make its way through very easily. It may also lead to changes in the stool, such as steatorrhea, fatty stool, which is the type of stool characterized when there is poor digestion and poor absorption of fats in the body. Problems to do with digestion in the cases of pancreatic cancer will also include abdominal pains and bloating that are felt after taking food, since the body may have a big challenge in digesting food without a good number of pancreatic enzymes secreted. Excluding discomfort, all these symptoms can give rise to very strong nutritional deficiencies and weight loss. In general, these symptoms can have an effect on the quality of life and the health status of the patient. 5. Loss of appetite. The loss of appetite, or in other words, anorexia, is a medical condition that refers to the low desire of someone to eat. As much as this can sometimes be occasioned, probably, by stress or sickness, persistent loss of appetite can be a red flag for any underlying health issue. This disorder affects not only eating habits, but can also lead to serious weight loss and nutritional deficiencies, weakening the body's ability to recover from illnesses. There can be many causes for a loss of appetite: psychological, such as caused by depression or anxiety; physical, during conditions such as gastrointestinal disorders, chronic ailments, or infections. Most importantly, however, loss of appetite is associated with a number of cancers, including pancreatic cancer. In relation to pancreatic cancer, this symptom of loss of appetite may be noticed with several causes. The food substances produced by the cancer may lead to altering the taste of food in ways that make it unappealing. More importantly, the tumor growth in pancreatic cancer may interfere with the organs around the stomach. When digestion is disrupted, one can feel full very fast after only consuming a small portion of food. This then discourages the desire for meals. Notably, patients with pancreatic cancer may gradually experience a loss of appetite that would tend to grow worse over time. If you have experienced an unusual change in appetite, coupled with other troubling signs, such as jaundice or weight loss, you should see your doctor immediately for comprehensive evaluation. 6. Fatigue. Fatigue is a very common symptom that can affect people for many different reasons. However, when it becomes persistent and unexplained, it should not be ignored. Fatigue refers to an overall feeling of tiredness or a lack of energy that doesn't improve even after rest or sleep. In the context of pancreatic cancer, fatigue is often caused by the body's response to the cancer and the metabolic changes associated with it. When cancer cells grow and spread, they consume a lot of the body's energy, leading to feelings of exhaustion. Additionally, the pain, digestive issues, and weight loss associated with the disease can further drain a person's energy. In cases of pancreatic cancer, fatigue can be particularly troubling because it can be severe, and combined with other symptoms like unexplained weight loss or jaundice, it can signal a more serious underlying issue. Fatigue related to pancreatic cancer is typically persistent and will not go away with rest alone. If you experience constant fatigue along with any other symptoms on this list, it's crucial to consult your healthcare provider as soon as possible for further investigation. 7. Changes in bowel movements. Changes in your bowel habits can often be indicative of gastrointestinal issues, and in the case of pancreatic cancer, they can be a key sign that something is wrong. Pancreatic cancer can lead to problems with digestion, which may result in changes in stool appearance or frequency. A common symptom is steatorrhea, which refers to fatty, pale, and foul-smelling stools. This happens because the pancreas isn't producing enough enzymes to digest fat properly, leading to its excretion in the stool. You might also notice that your stool is more difficult to flush or that it appears greasy. In addition to steatorrhea, you may experience diarrhea, which can occur if the cancer causes blockages or interference in the digestive process. On the flip side, constipation is also a possibility in pancreatic cancer patients, as the digestive system struggles to process food effectively. A change in bowel movements, especially when combined with other symptoms like abdominal pain, weight loss, or jaundice, should not be ignored, and you should seek medical attention promptly. 8. Back pain. Back pain is a common issue, but when it is persistent and comes along with other unusual symptoms, it could point to a more serious condition, including pancreatic cancer. In cases of pancreatic cancer, back pain is often the result of a tumor pressing on the nerves, spine, or other nearby structures. This type of back pain is typically located in the upper back, just below the ribs, and may radiate to the lower back or the sides. The pain might be dull at first, but can become sharper or more intense as the cancer progresses. Back pain that is associated with pancreatic cancer can also be aggravated after eating or when lying down. It is not uncommon for back pain to be one of the first signs noticed by patients, but it is often overlooked as a sign of something more serious. If you experience persistent back pain, especially if it is accompanied by other symptoms like unexplained weight loss, jaundice, or digestive changes, it is important to seek medical attention right away. 9. Blood clots. Pancreatic cancer can increase the risk of developing blood clots, which can cause various complications. This is because the cancer can alter the way blood flows through the body, increasing the likelihood of clot formation. If a person experiences symptoms such as swelling, redness, or pain in the legs, deep vein thrombosis, or chest pain, shortness of breath, and coughing up blood, pulmonary embolism, these could be signs of blood clots and should not be ignored. Blood clots associated with pancreatic cancer can travel to the lungs, heart, or brain, causing life-threatening complications. It's crucial to recognize the signs of blood clots early and seek immediate medical care if they occur. If you have pancreatic cancer and are noticing unusual swelling or discomfort in your legs, or any symptoms suggestive of a blood clot, seek medical attention as soon as possible.
10.
New-onset diabetes or changes in blood sugar levels. The pancreas plays a critical role in regulating blood sugar by producing insulin. When pancreatic cancer affects the pancreas, it can disrupt this function and cause changes in blood sugar levels. If you have new-onset diabetes, i.e., you are diagnosed with diabetes for the first time later in life, or if your blood sugar levels become difficult to control despite efforts, this could be a sign of pancreatic cancer. People who already have diabetes may also notice changes in their blood sugar levels that are not typical for them. Pancreatic cancer can make it harder for the body to process and regulate glucose, leading to higher than normal blood sugar levels. Additionally, symptoms of high blood sugar, such as excessive thirst, frequent urination, or fatigue, may become more pronounced. If you notice any of these symptoms, particularly if you have a family history of pancreatic cancer or other risk factors, it's important to seek medical advice. A change in blood sugar control or new-onset diabetes could be a red flag signaling the need for further testing. Pancreatic cancer is a particularly dangerous form of cancer because it often goes undetected until it has reached an advanced stage. Many of the symptoms listed here can be associated with other, less serious conditions, but if you notice a combination of them, especially if they persist or worsen, it is important to seek medical attention. Early detection of pancreatic cancer is key to improving the chances of successful treatment, and being aware of the symptoms can potentially save lives. If you or someone you know is experiencing these warning signs, do not hesitate to contact your healthcare provider for a thorough evaluation. Pancreatic cancer may be challenging to diagnose, but early detection and intervention can make all the difference. Stay vigilant and take your health seriously.